right, everyone, welcome and thank you so much for joining us for our student and trainee SIG events. We are really excited for our two presentations today. Before we begin, the student and trainee SIG board would like to briefly introduce ourselves, so I'll start. My name is Emily Hersch. I'm one of the co-chairs of the Society for Digital Mental Health Student and Trainee SIG and a fourth-year clinical psychology PhD student at UMass Boston. So I'll pass it to Crystal to introduce herself.
Hello, everyone. My name is Crystal, and I'm also a co-chair on the SIG with Emma and Emily, and I guess technically a second-year clinical psych student at Duke University now. Just wanted to say hello, welcome, and a big thank you to all the attendees and the speakers today. And I'll popcorn over to Emma.
Hi, everyone. My name is Em. I'm a rising fourth-year clinical psychology PhD student working with Dr. Bethany Teachman and a co-chair of the SIG as well, and also the student representative for the Society of the Digital Mental Health. And I am so excited to have all of you here today. And I will popcorn it over to Paige.
Hi, everybody. I'm Paige Anderson. I'm a professor at Georgia State University, and I'm faculty mentor to the SIG, and I just try to stay out of their way because they're so awesome, as we'll see today.
All right, thank you, Paige. We'll pass it over to Dr. Bethany Teachman.
Great, thank you. So great to see everybody here today, and yeah, just great appreciation for the work that the Student and Trainee SIG does. I have the pleasure of introducing Simon Daniel, who's going to speak for the first 10 minutes before passing it back to the Student SIG. Simon has been working with us at UVA's Thriving Youth in a Digital Environment, and a little while back when we started, we got a lot of feedback about there being sort of broad need for more advanced training in digital mental health, which is obviously near and dear to the heart of the Student and Trainee SIG. And so we thought it would be helpful to do some needs assessment. And we started out initially just doing that at UVA. And we shared some of those results last year. And then some of the feedback we got was at SDMH was that it would be really helpful to understand feedback from a broader variety of constituents. And so we were able to broaden it and get samples from many academic institutions, but then also from industry feedback as well about what they wish was happening in training. And so I'm incredibly appreciative of Simon's work in leading this effort, and he's going to share an update on what some of our results are telling us at this point.
Thanks, Bethany. So I'm going to share my screen, the first real test of the day. So just to quickly introduce myself, I'm a fourth-year PhD student in the clinical and school psychology program at the University of Virginia. And like Bethany mentioned, that I'm going to share some preliminary results from our training needs assessment that we've since expanded since last year's presentation. So the goal of this was to figure out what specific resources are needed for furthering research and practice in this area. And last year, of course, we presented on findings from our UVA-based needs assessment. And since then, we've expanded to other institutions and industry settings. And I will be presenting on some of those findings today. So our academic sample includes participants from UVA and other institutions. We have 107 participants, and this is the demographic and professional breakdown of those participants. We treated our industry sample as a separate sample, and we have 60 respondents from the industry, and this is the demographic and professional breakdown of those participants. Something I'll note here is that more so in industry than our academic needs assessment, that we had people working in multiple settings and fulfilling multiple roles. So as you can imagine, people doing a lot of research and consultation across different organizations. With this needs assessment, we gauged interest in several domains, including methods training, content training, and mental health and youth development, navigating university systems, and so on. The last two domains in this list are business administration and healthcare fundamentals, which were specific to our industry needs assessment. we asked our industry and academic respondents to select and rank the training domains that they felt were the most important for advancing research and practice in youth mental health and digital technology. And so I have bar charts to illustrate the overall interest and priorities that folks endorsed. And so here we have a bar chart for our academic needs assessment. The pink bars represent overall interest in each of the training domains, and the maroonish bars represent top priority, the percentage of individuals who considered something to be their top priority. And so here we see a lot of methods. Training is overall endorsed and also considered a top priority. And we have another bar chart where we have the training interests from our industry respondents. And so you'll notice here that we have two new categories, which are the healthcare fundamentals and business administration, that we gauged with this sample. And just visually, I know they're not side by side, but we can notice some things that are common across the two settings and some things that are different. Healthcare fundamentals is, there's a lot of overall interest in it, and it seems to be pretty highly ranked as a top priority. And so when we look at this side by side, if we kind of expand our ranking a little bit, not exactly overall interest and not exactly top priority, but the top three, we can see a little better now what the common training needs are and also where some sector-specific priorities come out. So as an example, we see that the healthcare fundamentals seems to be a pretty big priority for our industry folks. And some things in common that we see, things like open science practices seem to be a little not as highly ranked. So some general overall takeaways from these findings, we see that core research skills, including design, analysis, and measurement, are valued across both polls. And we noticed that our academic respondents considered this to be more of a priority. We also saw that commonality, how open science practices are a lower priority across both settings. And when we look at the training needs side by side, we also start to see some sector-specific priorities, like the healthcare fundamentals and business administration. We also noticed that technology training was more of a priority for academic respondents compared to industry respondents, and both settings prioritize professional development opportunities. And lastly, with mental health and development, or in youth development, there's less overall interest in these areas in both settings, but our industry respondents ranked these as more of a priority for training. So where do we go from here? TYDE has some additional work to do, analyzing some of the qualitative data that we've gotten from our needs assessment. And this will help us flesh out the picture a little bit more in terms of strengths, barriers, and consultation needs that folks cited. From this, we will plan to disseminate our findings and also work with various stakeholders to see how we can address training needs. And so for folks who are interested in updates to this work, I would say keep an eye out for TYDE's dissemination of these findings. And also please feel free to reach out to Bethany or myself with any questions you might have. Thank you.
Hyman, thank you so much. I will be reaching out to you. I'm teaching a doctoral class on AI and mental health, and will be eager to learn more about how to share that with students. Well, hello again. I'm Paige Anderson, and I am moderating the panel. Welcome to our session, Entrepreneurship and Innovation in Digital Mental Health, Navigating the Startup Space. I'll share that my very first job was as the full and only full-time employee of a startup, Virtually Better, that pioneered the use of virtual reality for exposure therapy in 1999. They are still in operation. And it was an amazing way to start a career. I wrote the grants, saw the patients, and cleaned the bathrooms. Since 2002, I've been a faculty at Georgia State University, and it's my pleasure to introduce our panelists. I also asked them to verify that they are human, and I will share those responses with you in the introduction as well. So going in alphabetical order, we will begin with Dr. Nick Allen. Nick's research works to understand the interactions between multiple risk factors for adolescent onset mental health disorders in order to develop innovative approaches to prevention and early intervention. He's currently leading a project with Google to determine the effect that smartphone usage has on mental health. He's the co-founder and CEO of Ksana Health, Inc., which focuses on remote behavioral monitoring and adaptive continuous behavior change support. And he can verify that he is human because he leaves everything to the last minute. Dr. Emily Bernstein earned her PhD in clinical psychology from Harvard University and was an assistant professor at Harvard Medical School and a clinician and researcher at the Massachusetts General Hospital and the Center for Digital Mental Health. In 2024, she joined an early stage startup as the associate director of psychology, where she now works leveraging generative AI to develop innovative mental health solutions. And she can definitely verify that she's human because she just had a baby. So she may be popping hearing out in and out of this. She clearly has a high tolerance for uncertainty, and we want to give her special thanks for being here. Dr. Valerie Hoffman is a psychiatric epidemiologist by training, earning an MPH from Yale University and a PhD from Johns Hopkins Bloomberg School of Public Health. Formerly the VP of Intervention Science at Wobot Health and Chief Research Officer at Meru. She's currently the CEO and founder of Pogo Research, working with digital behavioral health companies to understand their value by, for example, suggesting studies that will provide insights into how their products improve access, efficacy, satisfaction, equity, and cost. She can verify she's human because she tears up even thinking about the song Pomp and Circumstance as her oldest daughter just graduated from high school. Finally, Dr. Ben Nelson is a senior clinical research scientist and mental health lead at Verily, Google Life Sciences, and an adjunct professor at Harvard Medical School and Beth Israel Deaconess Medical Center, and a licensed clinician with a specialization in behavioral medicine. And he says he can verify that he is human because despite years of remote meetings, he forgets to unmute himself once a week. I can identify with all of these human qualities. So I asked the panelists to identify the types of topics they thought would be most useful from a list prepared by Emily based on your feedback from the SIG members. And our panelists zeroed in on questions related to the pathways and transition to industry and the future of the field. Which I just want to say to our attendees, you are the future of digital mental health. And I hope this panel helps prepare you to maximize the positive impact you'll have on our field and our world. So we're going to begin with some questions identified by our panelists and then open the floor to a live Q&A at about 40 minutes past the hour. You are also welcome to put questions in the chat. So to get started, I'd like to ask each of the panelists to share information about yourself that I maybe didn't include, that if you think it's important for this panel, and to briefly describe your career path and how you became involved in the digital mental health industry startup space. And I'll start with our new mother, if she's here.
Sure. Thanks so much for having me. In terms of my career path, I sort of just naturally ended up in digital mental health in grad school. I started out doing traditional experimental research, bringing people into the lab, doing behavioral tasks, and just started using smartphone apps because I really wanted to see how all these things were working in the real world. So I started using EMA platforms. And then I started getting more excited about, okay, now can we do the manipulations and the interventions on people's phones and then see what was happening? And it kind of snowballed from there. So I spent the first, 5 years of my post-grad career on the academic side and ended up doing a lot of consulting and industry collaborations and just more and more found myself wanting to be on those cross-functional teams and, full-time on a product and really getting to see it kind of all the way through instead of just popping in and out. And so I was fortunate to find a really good match with a startup team last fall to be able to join full-time. And so that is my best advice for people making the jump, is make sure you find a good team that you feel like is a good culture fit that you really believe in. So fortunately for me, it's been a great transition, and I'm excited, to continue learning from the rest of the panelists as well.
Ben?
Sure, I'm happy to go next. Great to be here with everybody. So a lot of my research in graduate school really focused around the analytical validation of different wearable devices. And I actually worked under Nick Allen, who's one of the panelists today, and he was very supportive of me reaching out throughout my PhD experience to different people in industry and learning more about that career path and trajectory. And then I'd say about partway through my postdoc, with support from my postdoc advisor, I started consulting for Valerie Hoffman at Meru Health under a contract role. And we got to kind of push out a number of different publications, and things ended up going well there. And so I was able to jump on there as a clinical research scientist. And that kind of started my career off in the digital mental health space. For me, I think making sure you're leveraging and networking and doing informational interviews as much as is possible and following up with those contacts intensely is really, really useful, even from like a third through halfway through your PhD program can be really useful. And then making sure once you look out into the industry landscape, trying to find companies similar to what Emily was mentioning that are kind of aligned with your research ethics and philosophy and work-life balance that you're looking for in your life.
Valerie?
Yeah, hello. My career has been long, but I'll try to be brief. So after grad school, I actually started in the digital behavioral health space, working for a company that was building a smoking cessation device, using graduated cessation and